Hi, my name is Tim Whitaker, and I'm a physical therapist at Utah Orthopedics in Ogden, Utah. I've been asked to answer a few questions regarding injuries and prevention of injuries with running by Ann Park, who's with Get More Life, and just going to answer a few questions off the cuff here through some clinical experience for the Runners Summit. And so I'll just kind of get into some of the questions that I was presented. The first one is, what would be my best tips for runners and hikers to avoid injury? And I'll say most often people kind of get outside of the bounds and not knowing their limitations, not knowing what their actual abilities are. For anyone starting a program specific to exercise, I think it's important to get screened. First, go and see your doctor. Make sure that it's appropriate for you to initiate an exercise program. Something that a lot of people don't know is that physical therapists have an initiative similar to an annual physical, like medical doctors provide. We do a screening, whether it be postural, running, gait analysis, but also we look for inconsistencies with what we call like length-tension relationships. Within the body, we've got certain postural dysfunctions that are really common because we lived kind of in this flexed world where everything's out in front of us. We work and drive kind of out here. We sleep in the same position, and we're not as physically active as we had to be 100 years ago. And so it's really important to get screened. One of the things that I've sent to Ann, and hopefully she'll have a picture of, is what's called a SMART goal. It's an acronym, so the S stands for specific, the M is measurable, A is achievable, R is relevant, and a T has a timetable. So if you kind of have an idea of what you want to do, something that you want to start, like activity, whether it be running or hiking or going back to the gym, I think it's important to sit down, have a journal, and just write down some of these specific things, whether it's, hey, I want to be able to hike to the top of this mountain, or I'd really like to run a 5K, or I'd like to get back into the gym, maybe something that you were able to lift 5 or 10 years ago. It's the more specific, the easier it is to obtain. And it's really helpful for you to log your progress, note any weaknesses or inconsistencies, and get help. Someone like what I do is help you meet those goals, to be encouraging, to be realistic, and to modify where possible. Another thing is, basically you want to make sure that you're not increasing the intensity of what you're trying to achieve, especially initially, by no more than 10% per week. So for example, if I'm training for a 5K, it wouldn't be smart to say, hey, I ran a mile, now I'm going to go ahead and shoot for that 3.1 mile goal. I'd say on a weekly basis, before you're able to meet that, unless you've really put yourself in the crunch, you run the risk of an injury. But a 10% increase would be, instead of a 30% increase like running from, say, 1 mile to 3, is go maybe a mile and a quarter or a mile and a half and kind of assess and see how you feel. Give yourself plenty of time to recover in between trying again. The second question is, lots of people get injuries from time to time. Is it possible to get past them and move on with your exercise routine? I may have already answered this, but it's nice to have options to know how to modify, whether you're working with a personal trainer, if you're in a class like at a gym, if you already have the suspicion or maybe you're post-surgical on something. My suggestion to my patients is always, look, show up a little early, talk to the instructor and say, look, I have an issue with my shoulder, I have an issue with my ankle, and there's going to be certain things potentially during this routine or this class that are going to be hard for me. Are there things that I'll be able to do to modify, or just kind of like let the instructor know? Or with your physical therapist, you may be able to come to a middle ground where, yeah, maybe you're not like ready to go jumping and do plyometrics yet, but there's certainly some things, there's some ideas that you can have gained by talking to them. Another question is, do I talk to a lot of people with IT band problems? And I would say this is a really common injury, especially for people who are starting out a new program. Probably two of the biggest things that I see are tightness from lack of stretching, both the quads and the hamstrings and the hips, but also an inherent weakness that we have in the hips. There's some really quick assessment or screening tools that we have for testing strength. One of them that you can do that's really, really easy is stand in front of a mirror, put your hands on top of your pelvis, and stand on one leg. If you can see that one side of your pelvis drops, there's a little bit of weakness in your hip. So it's really important not just to train hip strengthening moving forward and backwards, but a lot of the activities that we do in sports or in running, especially if it's like on a trail, there's a lot of lateral or side-to-side movement. And all the way from where your foot hits the ground and how you're contacting the ground from even your footwear can affect the amount of strain that goes through that whole what we call kinetic chain. So it's nice to have someone look at you. If you don't want to go in and get screened, then maybe find access to a treadmill, put a camera on top of a tripod really low, and just look at yourself run. You may be surprised at some of the things that you don't see when you run. Like maybe your knees come together like more knock-kneed, or maybe they're kind of bow out. Or maybe you can kind of tell like that little test I just ran you through, like when you're running and you see one of your hips drop, maybe you have what we call hip drop when you're running. And so by learning some exercises, you'll be able to focus specifically on some things and to avoid IT band issues. I'm a really big fan of foam rolling. I don't necessarily like to just roll back and forth. I'm really slow and methodical. I believe the fascia has a huge component to making sure that your IT bands don't get too tight. I'm more of someone who kind of camps out on one of those trigger points or top bands of tissue, and you really let the oxygen permeate into that tight band by holding it for at least 20 or 30 seconds, kind of periodically going through the whole muscle, not just the lines of the front or the side, but also side to side, like torsionally or circumferentially around your thigh, and just breaking up the fascial planes right there too. Another question that I have here is, do I see people who are able to run their whole life, or at least many years? What can I do to ensure that I'm able to run for a long time? I think this one's kind of hard to answer for everybody because there's so many factors that may be out of your control. Thinking specifically of someone who's maybe over the age of 50, some of us are dealt different genetic cards. There's physiological changes with time, like DJD or degenerative joint dysfunction. But I think it's important in anyone who is looking for, especially an endurance-related sport with some longevity, or someone who hopes to be able to do this for a long time, is to cross-train. I think it's important that you're not just putting a routine through your body, but if you can implement many exercises or a variety of exercises that help you to stay engaged and to stay active, the likelihood of you breaking down or getting an injury may be less. I think if something's new, you go back to what we talked about, like setting a SMART goal, increasing your intensity slowly, like 10% per week, until you're proficient at that, but at least it'll give your body more of a time to recover and hopefully prevent some injury. Hope that's good. Another question that I have is related to plantar fasciitis. This is something that a lot of people complain about. Are there any suggestions? I think definitely there's some suggestions here. By far and away, the vast majority of my patients have a lot of tightness in their calf muscles, or the gastrocnemius and soleus muscles specifically. A lot of what happens is that those two muscles can join, and they form the Achilles tendon, and it wraps underneath the heel, or the calcaneus. The front of the calcaneus, which is now, if we're talking about the bottom surface of your foot, has a band of tissue called the plantar fascia, and it runs from the heel towards your toes, towards the ball of your foot, towards all the metatarsals right there. What ends up happening is if the muscles in the back or the posterior side of your leg are really tight and shortened, they're pulling your heel one way, and they're in basically like a tug of war with the plantar fascia. So to take that tension out of the equation, if you'll work on stretching your calf muscles, you alleviate a lot of those forces. A lot of times people with plantar fascial pain, they talk about pain in the morning, the first few steps. Some of the tricks that I like to help people with is You've heard about rolling maybe on a frozen water bottle, like a plastic water bottle that has those little ridges. It's kind of nice to be able to put pressure down and roll the pressure towards the heel with something that's rigid, like a frozen water bottle. But it's nice to have the water frozen too because it acts as a local anti-inflammatory. Before I have people stand, I have them just doing ankle pumps, stretching, maybe that little trick right there with the frozen water bottle, and then getting on their foam roller with stretching their calves. It's important to stretch out the tissue before you put pressure along the length of the already tight band, causing more pain at that point on the bottom of your foot, down by the heel. The other thing that I find is footwear is a big issue with plantar fascial pain. And a lot of times when you kind of see fads rolling through, there's like a barefoot kind of craze, or right now kind of more with the big padded shoes. I'm not saying that one of them is bad or evil, but I would certainly say that not one footwear goes with every foot type. So it's important to know what works for you. I have been able to find a specific brand, which I'm not going to mention because I'm not partial to it, but and I'm not receiving any kickbacks or whatever. But I found a footwear or a shoe type that I really like. And the more that I kind of experiment, I do tend to experiment because I have a lot of patients that are really curious about a footwear or a foot type, and I have actually caused injuries to myself. So I think it's important to just find what works for you and maintain a good balance between the length-tension relationship of your calves and the plantar fascia, specifically to plantar fasciitis. Another question here, what are the warning signs that you really need to see a medical professional? Other than checking airway, breathing, and circulation like they teach you in CPR, I would say just knowing your body and knowing how long, if you go for, say, a run, or you go to the gym and work out, and you're typically sore from that, a couple days. If something goes beyond a couple days and over-the-counter anti-inflammatories or stretching don't seem to be doing the trick, I think it's important maybe even at that point to call into your doctor or call into your physical therapist and see if you can get screened for an issue. We have the ability to help people much easier if we get early access to someone at the beginning of their injury before it becomes like a chronic issue. Not to say that we can't help someone that has a chronic issue, but the amount of time that it usually takes, the prognosis is usually a little bit further out the longer you've been dealing with an issue. And I think women are much better at this than men for the most part. Men try to tough it out, and more than not, those are the ones that have those chronic issues that really seem to struggle. So if we can get early access to it, not necessarily like within minutes, give it I would say give it a couple days, and if something just doesn't feel right, trust your body and get in. It usually takes a week or so to get into your doctor anyway, so maybe a day or two would be the answer to that. And finally, the last question that I have here is, what would I recommend for someone just getting started with hiking or running? Like I mentioned before, I think screening is really important. I recently did a VO2 max test, and I was talking with a cardiologist who was screening a bunch of firefighters locally in our area. These are really healthy individuals. I'm really grateful for what they do for their service in our community. One of them was about to participate in a VO2 max test, and they found an arrhythmia in his heart and potentially saved his life. This is a healthy young person, under 40 years of age. So I think it's worthwhile getting checked out, just making sure that you're cleared. But like I said, we do have the initiative with physical therapy to do annual physicals for people. I think that's a really great way to find out maybe some of what your limitations are. You can use us as maybe your coach to meet some of your goals, to initiate a program, or to maybe modify some exercises that you're unable to do because of pain or weakness. I think specifically if it's running, maybe a good way to log a measurable goal with a running program on a treadmill would be to start with maybe 5 or 10 minutes of continuous exercise, kind of gauge how you feel after that. It might be good to give your a day or so of recovery before you try again, go up by 10% in your intensity. You could be out on a track, and maybe what you're doing is you're walking the first couple laps, and then if you're feeling like you have the energy, maybe you start jogging the straightaways and walking the curves. And you do that till you've done maybe a mile is a good way to kind of increase your cardiovascular endurance. If it's just causing a lot of pain, maybe eliminating ground reaction forces from maybe not a track, but maybe a bicycle, maybe starting on a stationary or recumbent bike and working your way to an elliptical and then to a walking program, and see if that doesn't help ease some of the pressure that you have in your joints. Those are some of my suggestions. I'm grateful for Ann Park for letting me have the opportunity to speak with you on the Runners Summit and with Get More Life. Thank you so much.